Welcome. I'm Andrea Clessy for Woman's Hospital. Colon cancer is a highly treatable disease if caught early. The best method for detection is a colonoscopy at Woman's. Dr. Kelly Finan explains who's most at risk for colon cancer and treatment options.
Colon cancer can affect all Americans. No one's immune from this disease. It's more likely to affect people as they grow older, and that's why screening is indicated over the age of 50. African Americans, we know, are usually diagnosed with a more advanced stage of colon cancer, so we know that race is actually more susceptible to this disease. Again, colon cancer is more likely to affect you with age as we grow older. We do know there's a link between obesity and colon cancer, and so again, maintaining a healthy body weight can help be a preventative measure. Most patients that have polyps are asymptomatic, and actually most early colon cancers can be asymptomatic. Symptoms patients can experience include rectal bleeding, abdominal pain, a change in the caliber or frequency of their bowel movements, bowel obstruction, a palpable mass, weight loss that's unexplained. So if anyone incurs any of these symptoms, they should definitely seek prompt medical attention. The steps to identifying a colon cancer usually initially start with a diagnostic colonoscopy, where we can look within the colon wall, identify any abnormalities, and obtain a biopsy where a pathologist can look at the cells under a slide and diagnose if there's a cancer or benign lesion. After the diagnosis of a cancer is made, we then need to do other workup, including blood work and CT scans, to make sure that the cancer is not spread anywhere, and then determine the proper treatment strategy. The treatment for colon cancer really depends on the stage at diagnosis. Cancers are staged in stage 1, 2, 3, and 4. A stage 1 cancer is an early cancer confined to the superficial bowel wall. A stage 2 cancer is spread through the full thickness of the bowel wall. A stage 3 cancer in general is spread to the lymph nodes, and a stage 4 cancer is spread to other parts of the body, such as the liver or lungs. The primary goal at treatment would be surgical resection for a cure, where we do a colon resection and put the bowel back together. If we found that the disease is spread outside the colon wall, we might start with chemotherapy first to help treat the disease that's spread throughout the body. After a colon resection, depending on the information obtained from the pathologist, we would recommend the patient either proceed with chemotherapy for further treatment, or surgery alone may be their primary treatment. The surgical treatment for colon cancer consists of a bowel resection, where we resect the blood supply and the lymph nodes that drain that portion of bowel, and then we put the bowel back together. The whole specimen can then be sent off to the pathologist for evaluation, and that helps us in staging and further treatment recommendations. Luckily, in this day and age, most bowel resections can actually be performed laparoscopically through minimally invasive techniques, where several small incisions are made throughout the abdominal wall. The colon can be mobilized, and then through a small incision on the abdominal wall, we can remove the colon and put the bowel back together. The surgery is the same as the old technique, where you had to have a large incision on your abdominal wall, but the recovery is much faster. We find patients get out of the hospital sooner, they return to work and their normal activities sooner, they have less pain, and their bowels usually wake up faster. When someone undergoes a colon resection for colorectal cancer, they're usually in the hospital anywhere from 3 to 7 days, depending on the extent of the surgery. They're usually back at home and getting back to their normal activities, but the typical recovery is still 4 to 6 weeks, because it is still a major surgery. It depends on the degree of activity involved in your job. After a colon resection, typically patients have had a bowel movement before they go home from the hospital, or will have one shortly after. Depending on the amount and location of the colon removed, sometimes patients do experience looser bowel habits until the body adjusts. The colon's main function is really to absorb water and to help concentrate the stool. So when we remove a portion of it, the body has to compensate for that. After 3 to 6 months, most patients' bowel function is returned to normal, and they may be having 2 bowel movements a day instead of 1 that they had before, but most patients still have good control and function. The success rate in treating colorectal cancer truly depends on the stage of disease when we diagnose it. An early stage cancer is much more treatable than a later stage cancer that's spread to other parts of the body. We know if someone has a stage 1 cancer, or again a cancer confined to the bowel wall, they have a 5-year survivability of 90 to 95%, which is great statistics. Unfortunately, that number continues to fall if the cancer is spread to lymph nodes and or to other parts of the body. but luckily there are still good treatment options out, so not all hope is lost. To decrease the risk of colorectal cancer, you really want to lead a healthy lifestyle. You want to eat a diet low in saturated fats, low in processed and red meats, as well as low in alcohol consumption. We would favor a diet high in fruits, vegetables, fiber products, calcium, and folate. Further, we know that maintaining a healthy lifestyle with regular physical activity and maintaining a healthy body weight helps prevent colon cancer. And lastly, avoiding smoking can have a positive effect on preventing colon cancer.
For more information, visit womans.org. Womans, exceptional care centered on you.